Hello students, we will discuss a surgical incision and identify this incision and find out the significance. What this incision is. See that lower abdomen, umbilicus is here, lower abdomen horizontal incision. What this incision is, identify, name the incision. It is Pfannensteil incision. Remember the spelling, Pfannensteil. Many people find difficult to tell the spelling, but remember the spelling. It is horizontal incision. It's cosmetically very good incision. So uses are for lower segment cesarean section. It is the incision used. For pelvic surgeries, it is used. For renal bed surgeries, it is used. It's a mostly preferred incision in all gynecological procedures by gynecologists. And advantages are can be done under spinal anesthesia, cosmetically very acceptable, and incision hernia is less common. Remember different abdominal incisions like upper midline, lower midline. Registrar's incision is the middle midline. It's called registrar incision. And right subcortical incision is called as a Cocker's incision. Left subcortical for splenectomy. Right pyramid incision not commonly used now. Battle incision is the right pararectal incision. Then for appendicectomy, McBurney's, Lanz incision, Rutherford-Morrison incision, Rocky Davis incision, Polar Wheats incision, and Pfannensteil incision, lower midline incision, oblique loin incision for ureter and retroperitoneal approach. So different incisions in the abdomen you have to know. So for that, please go through my book, both operative surgery and manual of surgery. You will clearly given everything in detail, which is also important for you in the exam, oxy and other things. So answer this MCQ, which of the following incisions is likely to cause inguinal hernias late sequelae? McBurney's incision, Lanz incision, Rutherford-Morrison incision, Fowler-Weis incision. So which incision among these four will cause the inguinal hernia? You know that inguinal hernia commonly by the appendectomy occurs direct inguinal hernia. So which incision causes? So find out and tell the answer, put it in the comment. So students, please go through my clinical methods in surgery with the video lectures about how to examine. My manual of surgery goes in detail about all topics as for CBMA syllabus, and my operative surgery gives the technical aspect, and my digital lectures through JP and gives all lectures covering everything for UG and basic for PGs, including specialties, instrument, X-ray specimens. So students, I hope you understood my lecture very well. Please go through the MCQ and comment tomorrow about the same. Thank you very much.